Okay, hello everyone. So my name's Hannah Hall and I've come from the Rotherham NHS Foundation Trust today. The Rotherham NHS Foundation Trust employs just under 5,000 people and serves a population of 265,000, so a smaller district general hospital. But we're going to be speaking to you about Standard 8, how we achieve Standard 8 of awareness of the Veteran Aware accreditation. So I'd like to start with going through my awareness first of all. Often becoming a veteran aware trust will fall to the equality, diversity and inclusion teams or patient experience teams to implement, and that can be daunting if you don't have much experience of this background, because it is a completely different set of terminology. You'll see those circles at the top there. The first time I presented that and I saw those circles, I went through all of them saying what they were, and then I got to the last one and I was like, mind blank. But that is when the group of people that we put together to help us achieve this accreditation really came in to support me and just jumped in, knew exactly what it was, explained it and came to my rescue. So part of that is about not being scared that you don't know everything about this topic when you're starting out, but also how important it is to get that right team of people around you, so that we can start to build awareness and teach ourselves that we can be good advocates for this work. So I know a lot about different cultures, religions, sexualities, gender identities, but really starting to build up my own awareness started from going out to different places locally, so local organisations, but also the local barracks as well, getting myself known, immersing myself in all this terminology, and starting conversations with staff members. So going around speaking to key members of staff that influence people, and hearing what their assumptions and their stereotypes about what this work will entail, and that really helps you to know where the starting point that your organisation is at, and what training and communications need to go out and be tailored to help challenge some of those assumptions, some of those stereotypes, or say, yes, this is exactly what we need to work on. So the amazing team that we built included patient governors, including a manager from Project Nova, a rep from the Military Community Veterans Centre, public governors, High Sheriff of South Yorkshire, staff, volunteers. I basically said everyone get in, because that is how you build awareness as well. If people are involved in the project, they'll want to further it. And then next it's staff awareness. So the things we did to promote awareness amongst our staff, one of the most important things we did was having completely separate comms. So this wasn't hidden in a newsletter. This was a separate email that went out to every single person in our organisation. And everyone in the organisation knows that when that happens, that topic is being prioritised by the trust. So that really sent a strong message. And then, as you can see, we've got boards that I took absolutely everywhere, information boards, so information for staff, information for patients, and general information about the change in the law and people's rights, just because this is really building that awareness work from that very basic level. And then getting training for staff, advertising that we've got training available so that people can learn. And again, I did that on the boards. We had separate emails. I did put it in newsletters as well. It just went absolutely everywhere. And then, so for the stands where I took them, if there was a staff event going on, if there was any training going on, I would take those boards. But then we also had things like Armed Forces Week, where we'd have them on display. And I'd speak at any opportunity at every single meeting to try and really raise the profile of the changes that needed to be made to become veteran aware. So you can see the lady on the slide there, she's holding up our flower signifiers that we've implemented on the wards. So for quite a while now, the forget-me-not flower's been used to help identify dementia patients on wards, but we've also implemented a poppy signifier for members of the armed forces community. It's optional for them to have this displayed, but having it there raises that awareness amongst staff, but also amongst patients, that they do have these rights. And then we've also got a hidden disabilities flower as well, which sometimes people can have more than one. So for Remembrance Week as well, we've got some organisations coming in. One of the local organisations got a van, so we're getting them all set up out front. Lots of promotion before this. We've got people selling poppies. We've got, again, my boards that take everywhere. And then we've got ward tea parties going on. So these have been shown to reduce the rate of UTIs even by having these regular tea parties, and it connects people that are on the wards that are a bit disconnected from the outside world as to things that are going on. So we've done one specifically on Remembrance Week to link them to all the activities that are going on in and outside the hospital. And then we've even got some activities such as rock painting. So for the rock painting, we're painting poppies on rocks. There's a information pack you can find on the NHS Futures platform about how to do this, and designs, things like that. So in terms of where else, how we raise staff awareness in the governance structure, having that champion dyad was really important to this, somewhere to escalate any issues that we needed leveraging at higher levels. So they oversee it, but then I also present to the Health Inequalities Task and Finish group internally, the Equality, Diversity and Inclusion Steering Group, Patient Experience Group, again, everywhere that I can mention it. In terms of actually changing the waiting list systems and things like that, really getting in there at chief nurses meetings, business managers meetings, again, making them aware of the law change, and so that they can start getting moving on putting things in place to make sure we can meet our obligations. We also created a story to the board, which was very moving, and really just trying to spread that word. So in terms of how we fit into the system locally, we've worked with the ICB, the Integrated Care Board, to say that we want all our referrals to have someone's armed forces status on them. So anyone, so our armed forces community, so ex-serving, serving, or significant family member. And then in doing that, we've also raised awareness among local GP practices, because by saying that, it's really said to them, we're putting this as a priority, you need to put this as a priority. We've explained the law change, we've explained how to become a veteran-aware GP practice, and encouraging local trusts to come along with this. There's a lot of work that can be taken from elsewhere and shared, so really trying to spread that word. So anything we're doing, we'll do an update and we'll say, this is how you can get involved, these are the links. In terms of impact, there are so many different ways that this has impacted us, and it's really about shouting about that when it comes to awareness. So some of the work that we've done on our reservist policy, we really want to get out to trust staff. So we have done a trust staff survey to see what it's like working for us, but also so that we can ask them, can we record your armed forces status on your electronic employment record, so that we can do targeted awareness raising in future, and then sending things out like the new reservist policy will be so much more targeted and really get that information to the people that we need to see it. Again, with the raising awareness of managers, and then primary care, everyone on here, but my passion is the patients and really what difference we've made to them. We've done patient information so that people know their rights. When we went out to visit local organisations, it was clear that they knew something had changed. They knew they were entitled to extra care, but they weren't quite sure what that was or how to fight for their rights to make sure that they do get it. So we've got that patient information there. We've got websites, so internal for staff information, knowing how they can support patients, knowing how they can support themselves, what support's available to them. But also then we've got an external website web page that contains all the information for patients, different support organisations that you know how much is available to help people. So it's just been all round a massive impact on every single part of our organisation. And then if we move on to just one way where we've started this, so we did only start doing this in March, April time, is the case study of one of our volunteers called Tug. So this is Tug, this is a picture of Tug, and he's a brilliant ward volunteer who got involved with the Veteran Aware Working Group. He's really proud of being involved. He was really proud even before this work started. He always wore his Armed Forces veteran badge, and that had a massive impact on patients' care, just wearing that. So we are encouraging all of our staff to apply and get that badge wherever possible, because just having that opens up conversations, just changes the dynamic. And there's other trusts that have implemented a buddying scheme, so we're looking into doing that, where if someone's in a bit of a crisis or needs someone support that is from the Armed Forces community, we'll have a list of people so that we can call them. So it's really trying to, again, identify who's in the organisation and building that awareness that that support is there amongst patients. So he's ever so proud to be part of the team, and he's just such a good advocate for this. The impact it's made on him is that he is far more willing, up for advocating for people, giving them information on support available, because now it's just at his fingertips. The patient information's there, the websites are there, just to be able to say, right, this is where you go, this and this, and then him being able to tell other members of staff that this is how you support members of the Armed Forces community. It's just made it seem really easy, because we've put everything in place, all the tools that people need to support members of the Armed Forces community. I'm really proud to have been involved in this work, and I just wanted to encourage all healthcare providers, no matter what your experience is of the Armed Forces, to get involved, to become veteran aware, because the changes are going to improve so many people's lives.